Hello all, this is Dr. Dheeraj Masapu. I'm a senior consultant in the field of neuroanesthesiology. This video is about the medico-legal negligence and medico-legal risk and which specialties are at risk. Okay, top 5 specialties I would like to show you. I made all the graphs. I will show you all that based on the statistics and data. But before that, I would like to show you what is the punishment that doctors get in India if the medical legal negligence has been proven. Okay, so this is the law. Along with that, what I am going to also show you in this particular video is I'll compare with other countries and show you what kind of punishments they are getting. Okay, let me go to Indian law first. Section 106 BNS, that's called Bharatiya Nyaya Sanhita. According to that, medical legal negligence comes under 304A IPC. Okay, so I'll just read out. Okay, and then you can only infer some kind of meaning from that. So this subsection states that whoever causes the death to any person by performing any rash or negligent act not amounting to culpable homicide shall be punished for 5 years. But if this act is done by a registered medical practitioner, then the imprisonment term may extend to 2 years. So for doctors, there is a discount of 3 years. So 2 years is the jail term along with fine. So this is the punishment in India for the medical negligence. Okay, so if it is causing death of a particular person. So then let me show you how it actually impacts the health care in India in future. So, and I'll compare with US also. What happens is, so because of this kind of rules and regulations, what happens is defensive medicine practice will increase. So what is defensive medicine? So in order to protect yourself, what you will do is you will put a lot of tests on the patient, and some will be necessary, some will be unnecessary. So since people get scared, right? So they put a lot of tests on the patients, and the healthcare cost for providing the same service will increase by 25 to 30% on the patients. And it's been proven in USA, since US also have these kind of laws in that country. So they actually face around 60 billion to 800 billion costs per year because of this defensive medicine, which will increase. And India also is following Western countries, right? In India also, this kind of defensive medicine practice will more and more increase, and our healthcare costs are going to blow up. This is going to be one of the main reasons. Okay, let us compare with other countries and see. In other countries, for example, USA, if some medical legal negligence is happening in this level, the fines would be around 600 to 700,000 US dollars. That's a very big amount. And a similar profile is in Australia, where 600 to 700,000 Australian dollars would be the payout. Okay, and in UK, there is, I couldn't get a specific amount, but there is no jail and all term in all these countries. It is more about the compensatory fees only. Only in 2 countries I could see this kind of a jail term, that is in India and in UAE. Okay, UAE also 5 years of jail term along with 500 dirhams of fine, and Saudi also there is a fine and imprisonment amounting to diya. Okay, so we are actually almost our punishment structure is similar to UAE and Saudi Arabia, not in relevance to other Western countries. So let me show you what kind of specialties are more prone for this. So topping in the list is obstetrics and gynecology. You can see in this particular graph. So this is the graph. I took data of 2020, 2021, 2022 just for you to get a rough idea, because almost it is following the same pattern. There is no point in seeing some 30-40 year statistics. These 2-3 year statistics will roughly tell us which specialties are prone. So topping in the list, this red color, you can see every year consistently obstetrics and gynecology is topping the list. And the reason would be, birth and labor will be conducted in several places, and some centers would be having good infrastructure, some wouldn't be having, and so many factors would be there. And by default, labor and pregnancy is related with risk, because there so many eclampsia, pre-eclampsia, so many postpartum hemorrhage, placenta previas, different grades of placenta previas would be there, anesthesia related complications. So many factors would be playing a role here, and then maybe that is the reason medical legal cases are more in obstetrics and gynecology. And the second specialty which is topping the list is surgery. The surgery is a broader term, so all the specialty surgeries, cardiac, neuro, gastric, everything will encompass in this surgical list. And the reason is again same. So basically what happens is, in developed countries, anesthesia, radiology, and those specialties are there which are topping the list. But in India it is different, because in India admitting consultant is having more brunt, and surgeons, since they admit the patients under them in any hospital, so they are having higher chances of medical legal cases. Number 3 in orange color you can see is anesthesiology, emergency medicine, and next is anesthesiology. So emergency and anesthesia, between that in India, emergency medicine is having higher medical legal negligence. The reason being, any patient who's coming to the casualty, the first one department they would be facing is emergency. So anything it goes wrong there, they will directly see, right? If something is happening inside the operation room or something, they wouldn't directly see what is happening. But in emergency, it is almost like open. Everybody would be seeing what is happening in the particular emergency care, and then so more chances of patients suing emergency physicians is there. And next you have pediatrics. We all know anything happens to children is taken utmost as a serious aspect. So pediatrics, and also a lot of vaccination disputes and congenital anomalies and abnormalities and those aspects also. And by default what I observed is, and even when I am going as a parent to some pediatrician or somebody, if something goes wrong, even I get irritated. So in the same way, I think when somebody is getting children to pediatrician, they will be totally in a different mindset. The same person who will be dealing other aspects in a different way, when they're getting their children to pediatrician, would be dealing in a totally different way. The mindset totally shifts and changes. That is what I observed. So that is the reason maybe pediatricians are more prone for medical legal negligence cases. And next is radiology. So radiology, people would be thinking that it's a safer specialty, but it is not, because when you report something, and for example if it's the wrong side or a wrong diagnosis, if something goes wrong with the patient, and if that is leading to death of a particular person, then you will be in the soup. So radiology also is not a very safe specialty. It might be a cool specialty without night duties. That doesn't mean that it is a safe specialty. Don't get confused between both. So these are the top specialties which are leading in the medical legal cases in India. In other countries it is different. In other countries, anesthesia, radiology, and other specialties are topping the list, but in India it is totally different. It all depends upon who is admitting the patient, who is the face for the patient. So that decides who is going to have more medical legal negligent cases. So thank you guys, and hope you got an idea about the medical legal negligence cases and which specialties are more prone. So thank you. And I know my WhatsApp group is getting saturated. I'm sorting out, I'll do something with that, or maybe I'll shift over to Telegram. One of that I will be doing. Okay, and try to join the channel. I'll do some videos specifically for members in future, because some of the videos I can't openly put in the public forum. I have to restrict some of the videos which I'm doing. So this I would be doing for members. So thank you very much. As usual, Dr. Dheeraj Masapu logging off. Roger that.